I'm sure there are a whole ton that I don't know of different treatments for the skin, and you talked about doing consulting. Give us an idea of some of the treatments that you do and how you come about to that decision on what type of treatment to give a client.
What I usually do is we have a conversation. I look at what people have been using on their skin. We talk about, some people say, oh, maybe I have dry skin. I want to make my skin look more youthful. I have hyperpigmentation and brown spots on my skin. Those are kind of general concerns that maybe people have. So usually when someone comes in, we talk about maybe a specific facial treatment they can have, and I offer several of them. I have a whole category which are called age defense, and they could range from a vitamin C facial to a pure collagen facial. I do glycolic facials, and basically what they are there's specific treatments to exfoliate the skin, to add moisture hydration into the skin. I also do facials for people who have acneic skin. I mean, it's not always about age defense. Sometimes people have acneic skin, or there are people who maybe have very sensitive skin. So maybe they have to have a different type of a treatment that's not going to be too aggressive on their skin. People with rosacea oftentimes have to be careful what they put on their face.
And what is rosacea? Maybe I'm the only one who doesn't know what it is, but what is that?
Rosacea is actually a medical condition, and what happens is, and they're not quite sure why people get rosacea, but it's reddening of the skin. And it's very common, especially among women. And what happens is your skin, you look like you're blushing all the time. And over time, the blush never really goes away. And sometimes it actually appears as red bumps on the skin. So it's actually a medical condition, and often it's treated with topical antibiotics, or sometimes antibiotics that you take internally. So when people who have rosacea, they have to be careful of certain triggers. Sun sometimes triggers it or flares it. If you use products that are too harsh on your skin, they can irritate it. So they're always walking that fine line between using products to treat the skin, but not crossing over that line so that it becomes too irritating for them. So, so we have a whole lot of, they may have a special type of a treatment I need to do for them. In addition to facials, I also do waxing. That's a big service for a lot of women. Brow waxing, body waxing. I do makeup as well. And my waxing that I use is a liquid soy. It's called Nudaz. It's kind of a unique wax. I've used it for many years, and it's a great product. And it works well for all skin types, and it's antimicrobial, so it's an excellent product.
And what would be a typical time frame if somebody comes in, and we understand you work, and we'll get into that later, that you try to do it by appointment because you want to make sure you give the best service possible and you don't have as many walk-ins. But what would be a typical time frame? And I know, of course, it depends on the treatment, but would you expect a half hour, an hour for certain for time appointments? For a facial appointment, I usually tell people to plan about an hour and a half. My facial takes, they always include, especially for first-time visitor, like I said, a little bit of a discussion up front of kind of their health history. And then I usually have them, they go into the facial room, they get all set up. I always cleanse the face, I analyze their skin, we always do some type of an exfoliation. If they need extractions on the face, I do that. Massage, which is usually people's favorite part, face and neck massage, and usually some type of finishing mask. So all the facials are about an hour and a half long. What differentiates them is the treatments used during the facials. As far as a waxing appointment, I can vary a facial waxing about 15 minutes. And then if we do makeup application, again, it depends. It could be a quick makeup application, 15 minutes, or someone, maybe 45 minutes. And then you'll work, if it needs to be on a consistent basis, you'll work with them whether they come on a monthly basis or whether they come every other month, but you'll go over a treatment or a home treatment with them.
Right.
Like you had mentioned before.
Exactly. I think, like I said, it's important to be consistent with your program. And skin, like anything else, you get the best results if you're willing to make a commitment. So you want to make a commitment, whether it's to come in for treatments. Usually I recommend, if people ask me how frequently should I come in for a facial treatment, I say if it's primarily for an age defense or age management treatment, I recommend between 4 and 6 weeks. And the reason why is because skin cells turn over about 28 to 30 days. So that's a good time frame to come in. If someone has problematic skin or having a lot of breakout, they may want to come in a little bit more frequently to help keep the skin clean. So people always ask that. So that's a good time frame. And then of course you always want to, again, be using good home care regimen.
with teenagers, how much experience do you have with teenagers who, of course, they tend to break out more than adults, and both women and men? Do you have customers that use you for that?
Absolutely. I actually have some clients who have adult acne. It's amazing, but not just teenagers have acne. Adult acne is actually more common than you think. And again, it happens a lot to, again, women, especially as they're going into middle age. Sometimes for hormones, they may develop adult acne, which is very frustrating. So I have some of that. I do have some teen clients. A lot of my clients, sons or daughters, they'll bring them in. Especially boys, when they reach a certain age, because of the way their hormones are, it tends to stimulate a lot of oil production. And that combined with not necessarily great hygiene or maybe sports, sometimes that can cause skin flare-ups. So I do some teens as well. Teen facials are usually a little quicker. I would say more like an hour, because they tend to be more about cleansing, not so much about massage. And especially for very oily skin, you don't want to massage an oily skin, it just stimulates more oil. So they tend to be a little quicker.
Very interesting. Now, do you work in conjunction sometimes with, let's say, primary physicians, with people to make sure, because if they're possibly using an antibiotic or an ingestible type of, I mean, obviously you need to know that and try and work around that.
Absolutely. So as part of the intake form, I always want to know if you're on any particular type of medications. For example, if you're on Accutane, or if you're Retin-A, there are certain things that you may not want to be waxed if you're using a Retin-A, because it could be too irritating on your skin. So I like to know all those things up front. If someone's under a doctor's care going to a dermatologist for treatments for their skin, of course I want to know that it's okay with their dermatologist if they come in for facial treatments. I also work for a plastic surgeon 2 days a week. So I also have a lot of experience on the medical side of the business as well. So it's interesting, I get to bring a lot of that into the salon with me and share this with my clients as well.